This is a demonstration of Wirecast. 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 This is a demonstration of Wirecast.
Are the mics on? No, let me get you that. Just go. We got Calm with you?
What do you need? Sorry, I didn't understand you.
Do we have communications with you?
This is a demonstration
Can you hear me?
of Wirecast.
Yes, I can hear
All
you.
right. Perfect.
You ready to go?
Let's go.
All right. Call to order the State of Nevada Board of State Prison Commissioners. Scheduled for today, Friday, March 20th, 2026, the time being 1:30 p.m. We will start with the roll call.
Governor Lombardo,
Here.
Attorney General Ford, Secretary of State Aguilar,
Here. AG,
Governor, we have a
just so record, AG Ford's
This
at a
is
funeral.
Demonstration of Wirecast.
Can you hear us okay?
Yeah, I can hear you fine.
Okay. All right. We'll move on to the first opportunity for public comment. Do we have any public comment there in Carson City? Second. And we'll do it. We have any there in Carson City?
Just for the second one, Governor, nobody right now.
Okay, do we have anybody here in Las Vegas for public comment?
This is a demonstration of Wirecast.
All right, seeing none, we'll move on to agenda item number 3, acceptance and approval of the minutes from June 13th, 2025 meeting for possible action. Do you have any concerns or questions or corrections, Cisco?
No, Governor, motion to approve?
All right, we have a motion for approval. All those in favor signify by saying aye.
Aye.
Motion passes. We'll move on to agenda item number 4, the Chief Medical Officer report for information only.
This is a demonstration
So
of
Cisco,
Wirecast.
Dr. Som is not available, but Dr. Williams is here if you have any questions. If not, we will move on to agenda item number 5.
No questions.
All right. Moving on to agenda item number 5, director's comments and departmental updates. Director Ring.
Yeah, so this is James Arenda, Director from the Nevada Department of Correction. I think it's important to go over the deaths issue that has been
This is a
trying to be
demonstration of
addressed
Wirecast.
publicly this year. I'll go over since January of 2025. But in 2025, there were 76 deaths total in the Department of Corrections. 16 of them have been identified as suspected or confirmed overdoses. Of those suspected or confirmed overdoses, 15 out of 16 of them have come back to a drug called K2 and Spice, which is a synthetic opioid, cannabinoid, synthetic cannabinoid. 8 of those deaths have been labeled as a homicide. 6 of those homicides were related to drug debt, which could be correlated to the K2 Spice that's coming into the facility. Out of the 76, also 4 were identified as a suicide. There are still some pending as autopsies, but this is the data I have as of today. The rest are identified as natural deaths. 2026 to present, we had 19 deaths. 4 of them have been identified as suspected or confirmed overdoses. All 4 have been identified as K2 and Spice. 1 of those was a homicide and has not been identified of the source or the reason for the homicide as of yet, still under investigation. And we've had 1 suicide. During the year of 2025, we've had 248 incidents that of K2 and Spice suspected
This is a
overdoses.
demonstration of Wirecast.
Of all them, each one goes to the outside hospital to be cleared first, some remaining in there for days. And each person that goes to, offender that goes to the outside hospital has to be accompanied with a minimum of 2 correction officers for the entire time there. All those correction officers are considered on overtime since there's no official post for transportation to outside hospitals for that type of emergency. In January 1st to today,
This
we've had
is a
36
demonstration of
incidents of
Wirecast.
suspected overdoses. And as I mentioned, that 4 of those have been identified as deceased based on the overdose. NDOC just deployed a mail drug detection scanner at each facility's mailroom. That occurred, we started implementing in December of 25. These mail scanners go through the mail that comes into the facility, the U.S. mail, and scans them for potentials for
This is a demonstration
any
of Wirecast.
material or any drug that comes in the mail system. Some of that mail or most of that mail is not detected by the human eye for drugs. The drugs are for K2 and Spice are actually infused into the lettering of the mail, which becomes the obstacle that corrections has with identifying the drugs coming in through the U.S. mail. Only 20% of the U.S. mail coming in can actually be scanned in these systems.
This is a demonstration
And even
of
at that
Wirecast.
20%, large quantities of the mail has been detected with laced with K2 and Spice. Those have been detected and intercepted. Department of Corrections has applications currently, applications that go on to the tablets that are offenders are issued. The state vendor ViaPath is now assisting in reducing suicides and oversides. One of those applications that is coming onto the tablet
This is a demonstration
in
of
April is
Wirecast.
called FreeMind, which clinicians can prescribe to those to assist clients that have indicators of potential suicide risk. It will offer 24-hour journal records, mental health referrals, emergency clinical notifications, and much more. The other application is called Breaking Free. It's an application to provide additional substance use disorder tracking and treatment. These will be extremely important to areas of the state that will have little mental health or substance use disorder access
This is
by
a
clinicians.
demonstration of Wirecast.
This will help all offenders in the system. And the Nevada Department of Corrections is also in the process of installing what's called OnMed clinical rooms at Lovelock Correctional Center, Northern Nevada Correctional Center, and the High Desert State Prison. These will allow a live video feed with actual clinician, a live clinician from 8 in the morning to 8 p.m. at all 3 of those locations during the weekday. It assists in enhancing medical and mental health services for having more access to
This is a
medical and mental health
demonstration
care.
of Wirecast.
And last that I have is that another area that has recently been brought up through the Nevada Department of Corrections Constituent Services is why the department is paying tort claims and why is the state paying tort claim settlements 5 to 10 years after a case opens. With that is most cases, which could be a question referred to the Attorney General's office that handles these tort claim cases. But most of these cases
This is a
take years,
demonstration
if
of
not up to
Wirecast.
10 years before they actually get settled or get through the court processes. That's why we are paying tort claims out today that are cases that could be 5 or 10 years old. That's all I have on updates.
So question, Governor Lombardo, for the record, does any institution, nationwide, do they do digital mail to where we
So-
don't have to worry about the drug overdoses?
I meet with every director for the Nevada
This
for
is a
Department of Corrections around the
demonstration
country
of
every 6
Wirecast.
months. And I would say at least 90% are digital mail. And the ones that aren't digital mail are going to be attempting to do digital mail starting in 2026,
Is that going to be us?
hopefully.
Because everybody has their pads, right?
Yeah, the only
Or
difference
they
in the
can
state of
receive it
Nevada
through
is
the
they're,
community.
yeah, they have it all with them all the time.
Right.
And they can use
No, I
it.
mean, if they don't have a pad, like they got restricted for discipline reasons,
They will
they can
still get
still
a
get
pad.
mail.
They will still get a pad.
Okay.
We just restrict the
This is a
items on the
demonstration
actual
of
iPad that they
Wirecast.
can't have if they get disciplined, unless they destroy the pads themselves. And we'll have a process for that if it does go digitally and how we have access to regular mail.
I mean, that could be a quick fix on the suicides. Not the suicide.
The overdoses. Absolutely. It is a quick fix.
Questions? Mr. Aguilar?
Yes, Cisco, for the record, you mentioned in 2025 there were 76, you said 16 overdose, 8 homicide, 4 suicide, and then the remaining, is that 48 were natural deaths?
So for correction, this is Jim Zarenda for the record. The correction of that, there's 48 that are left to be determined. Not all of them have been determined because some are still pending in the autopsy stages. But the ones that we did get back from autopsy stages have been identified as natural deaths.
Okay, thank you. And then to follow up, Cisco, again, on the governor's question regarding the scanning digital mail, the United States Postal Service can't recognize when these letters have,
Wirecast.
and I know the reason I'm asking this question because we do get elections mail and, there's been substances in those envelopes that the post office has caught before they even reach our office.
So James Zarenda again for the record. So we do not go back and notify the post office every time we get them.
No, but the post office scans the mail as well, and they notify you before it even reaches you.
So the post office only scans for narcotics, for drugs that are actually detectable. Talk about K2 and spice, it's undetectable.
Understood.
So we don't detect K2 and spice. Those mail scanners will actually detect for something that's not paper or ink, identifying that there's most likely been tainted mail.
Okay, thank you.
No further questions?
No, I appreciate the clarification in the report today. Thank you.
All right, we will close. That's a discussion only. We will close agenda item number 5, move on to agenda item number 6, administrative regulation not subject to NRS 233B process for discussion and possible action. And before I ask for a motion, just go, if you don't have a problem, I'll take them all together.
That works for me. Thank you.
Go ahead, sir.
All right, so we're presenting 4 regulations to this committee. One of them is a new administrative regulation and 3 are revisions. The first one is Administrative Regulation 156, which is Office of the Inspector General. In this, it just there's no current administrative regulation that identifies the Inspector General's office and Department of Corrections on their what they're required to minimally cover. The reason why this was added as a new regulation is because starting in June of 2026 will be what's called Community Transitional Programming, which was brought up as a new NRS into a new NRS involving allowing those that have 18 months prior to discharge or release to parole or eligible for parole, as long as they have nonviolent crimes and non-sex crimes, they can be eligible for community release by the Department of Corrections. The supervision is going to be done by the Inspector General's office, and that's what that addresses in this new regulation is their role in it. No questions on that. I'll move to the next one. The next one is Administrative Regulation 422, which is searches and seizure standards. Under search and seizure standards, all the changes in this were added because the National PREA, which is the Prison Rape Elimination Act, had revisions to their standards. Most of those revisions are searches of women offenders. Those changes were specifically added into this administrative regulation just to match with the federal law.
This is a demonstration of Wirecast.
And the other one that we added into this was it was a minor change, but it was formatting for an improved clarity and consistency throughout the directive or the regulation to make sure that the wording is the same in each section when wording was changed in the last AR that was approved.
No question.
Okay, the next one I'm
Any
gonna,
questions?
No questions.
All right, the next regulation I'll address is Administrative
This is a
Regulation 430,
demonstration of
which is
Wirecast.
transportation of offenders. Under 430, changes of that, we changed in there about transportation, had it clarified about transportation of offenders for court, transportation for offenders for medical treatments, and transportation of medical offenders, just to consolidate all the regulations to ensure that they match on the transportation of those offenders
This is a
and how it's supposed to
demonstration of
occur.
Wirecast.
The other thing we added was permission to transport in a private vehicle if there's an emergency situation outside of a state vehicle. Those situations would happen as if we had community release offenders that were working, that are community trustees, that are under the supervision of their job. If there's an emergency situation to an outside hospital, it will authorize that a private vehicle can be used in these emergency situations. It also identifies the minimum of staff that are required to transport maximum custody offenders. It also approves contractual employees, which are vocational reentry program employees or approved volunteers that can transport minimum security offenders to their locations for their jobs or programs or treatment that are already assigned to be able to have discharge or work in the community. Also, it identifies and matches with a AB 292 bill that came out, which
This
is
a demonstration of Wirecast.
how to transport or transfer pregnant offenders from either one area of the facility to the other or to an outside location, identifying that pregnant women cannot be handcuffed in certain ways, can't be handcuffed in the back or front, and if they are, there's a procedure for it in here that requires reports to identify why it is necessary for safety and security
This
and what
is a
actually happened
demonstration
to
of Wirecast.
handcuff a pregnant offender in the front or the back. Then it was just minor changes for just consistency with other ARs that were changed in here for typos. That was it.
So on the pregnant offender, for the record, Governor Lombardo, the only authorized restraint is ankle.
Ankle, that is correct. His leg irons.
Any questions, Mr. Aguilar?
No questions.
All right, the last one I'm going to
This is a
talk about is
demonstration
Administrative
of
Regulation
Wirecast.
707, which is offender disciplinary process. This was changed. We had a notice of charges was changed. It was something that was litigated in court that was compared attempt and conspiracy from the actual violations. We had an agreement just to identify by charge when it is attempt or conspiracy or the actual violation, which we identified in this. The only other thing we added into this was something called bondable and non-bondable violations. What that means is a bondable violation is it identifies in this administrative regulation those charges where administrative segregation is not required. And then non-bondable violations are identified in this regulation that are automatic to a charge that has been issued, that are automatic restrictive housing or segregation status until charge has been heard in the
This is a
hearing.
demonstration of Wirecast.
The other thing that was added to this was a new charge, since we now offer tablets to the offenders. There's new charges of general charges of the use to offender, to misuse of the offender that was not authorized for use of the telephone system was added. The other thing that was added was when you have someone that's in minimum security, if they do not allow the staff to have access
This
to
is a demonstration of Wirecast.
passwords or onto their cell phone, computer, or tablet device, it's identified as a specific charge here. Same thing within an institution. If they do not allow staff to have access to their tablet into their device, it's another different Class A charge for the offender, which has been identified just as well. And that is, and also the last thing I got was we changed into this directive
This
that
is a demonstration
escape
of
was a
Wirecast.
Class B charge. It is now moved to a Class A. That's it.
Any questions?
Yeah, this is more clarification. What is a community trustee? Trusty.
Sure. So community trustee is someone that is a minimum security offender that has been approved through classification to allow them to actually work outside into the community. So they could work, whether it's a job, a
This is a
state grounds, they can
demonstration
actually
of
work
Wirecast.
during the day, not outside of the prison system. They can work into the community.
Got it. Thank you. And then on page 4, letter N and letter O, community trustees capitalized in one and not in the other. I don't know if that makes a difference on your regulation. I think it's number 10, 10O,
This is a demonstration of Wirecast.
and 10N. CNN, it says classified as a community trustee and it's
Yes.
not. So.
I
And then-
don't know why, but if that is, so that should be the same, or if it is correct, we'll have that adjusted
Okay.
before putting it up.
That's all I had. Thank you.
Yeah.
All right. If there are no further
This is a
questions, I'll entertain a
demonstration
motion.
of Wirecast.
Motion to approve items number 6, AR 156, AR 422, AR 430, AR 707.
All right, we have a motion for approval. All those in favor, signify by saying aye. Aye.
Aye.
Two passes. All right, we'll move on to second opportunity for public comment. Do you have any public comment during Carson City?
We do.
This is a demonstration of Wirecast.
Tanya Brown, whoops. TONJA, BROWN, Advocates for the Inmates and the Innocent. Good afternoon, members of the Board of Prison Commissioners. As an advocate for the inmates and for the innocent, I am speaking on behalf of the families who have been incarcerated, who have incarcerated loved ones. Many of us know the fear and the helplessness that comes from not being informed when a loved one is experiencing serious medical issues. Families are often left unaware of whether proper treatment is being provided, whether a condition is worsening or
demonstration
too
of
far, often
Wirecast.
whether their loved one has died. No family should be the last to know that a medical emergency has occurred. I want to share a personal experience that shows why this issue is so important. In 2007, my brother, Nolan Klein, was rushed to the hospital after contracting MRSA that began shutting down his vital organs. No one from the Department of Corrections notified our family. The only reason I learned of what was happening was because an inmate called me. Nolan survived that crisis, but the lack of communication was devastating.
Demonstration of Wirecast.
Afterward, I contacted the director, and because my brother had recently completed a HIPAA form, I was finally able to receive updates about his condition for the next 2 years. However, HIPAA authorizations expire every 3 months and must be renewed. Without a simple, accessible way to update these forms, families are left vulnerable and uninformed during the moments when information matters most. For this reason, I respectfully ask that this board authorizes and implement a downloadable HIPAA form on the Nevada Department of
is a
Corrections website.
demonstration of
Families should be able to
Wirecast.
access the form, sign it, send it into their loved ones for signature, and receive a completed copy in return. This would ensure that when an inmate is rushed to the hospital or taken to the infirmary, families can be notified immediately, rather than hearing about through the news, through rumors, or from another inmate who happens to call. Providing this resource would greatly reduce the stress of fear families experience when their loved ones face medical emergencies or ongoing health problems. It is simple, practical step and would bring transparency, compassion, and accountability
This is a
to
demonstration
a system
of
that desperately
Wirecast.
needs it. Thank you.
Can you turn on your microphone?
My name is Nathaniel Williams. I've spent 22 years incarcerated, 4 as a juvenile, 18 as an adult, all in Nevada. While I was in the Nevada Department of Corrections at Southern Desert Correctional Center, I was putting in grievances and kites for dental pain. I had impacted wisdom teeth, they got infected. I was being denied dental treatment. And I went up to medical one day on an emergency grievance. I was
Demonstration of
given
Wirecast.
antipsychotic medication, drugged, transported from Southern Desert Correctional Center to High Desert State Prison, stripped naked. I woke up bloody and bruised, put in a strip cell 5 days. They threw away my property. I proceeded to get retaliated on. That's a little bit of what led me to be so involved. I won lawsuits. I won I got implants for my dental teeth, or for my teeth. And I'm involved with a lot of families out here, and I hear a lot of the stories from families about why people are dying in prison and how
This is a
people are
demonstration of
getting written
Wirecast.
up when they refuse to house at High Desert for classification errors, like Jacob Herman, who lost his life. He was a minimum custody offender who was supposed to be going home, but instead they put him in the cell with someone who said that they will take anybody's life if they move him in that cell. Isaiah Sharp, Thurgood, Malik Avila recently died at the hospital after an encounter with correctional officers, Christian Walker, Patrick Odell. These are
This is a
medical
demonstration
stories of medical
Wirecast.
neglect. Daniel Rosenberg, Terry Clark. These are people that I was helping with grievances, and they were getting denied medical care while they were in prison. They ended up dying from cancer. The list goes on. Our prison population decreased, yet the amount of people who lost their life last year almost doubled. We are already at approximately 17 people having lost their lives this year. And some of these situations are from K2, but to my knowledge, K2 doesn't kill people,
demonstration
fentanyl
of
does,
Wirecast.
and we can test for fentanyl. Cell phones are a big issue. Cell phones are not coming through visitation, and they are not coming through the mail. So there's only one way cell phones are coming into prison. So I just wanted to put this out there because it is something that was not discussed when we were talking about the people who lost their lives, and that's people have lost their lives from dental infections in the NDOC. Thank you.
This is a demonstration of Wirecast.
Anybody else for public comments? Governor, we have one more coming to the table.
Okay.
Two more.
Me now? No, I'm good. I was sitting too long.
Is it on?
Yes.
Okay. To the members of the board and the governor, my name is Dorothy Jackson, mother of Donald Paul Jackson,
This
inmate
is a demonstration of
1075411
Wirecast.
at the Southern Desert Correctional Facility. A request for review of disciplinary conviction that was imposed despite credible evidence identifying another inmate as responsible and despite availability staff witness being denied testimony. On April 15th, 2025, following a dormitory shakedown, my son was written up for the possession of a cellular phone. The same evening, senior staff Sergeant Kelly and Senior CO Ballard retrieved an emergency grievance from another inmate known as ATL,
This is a
who admitted the
demonstration
phone
of
belonged to him
Wirecast.
and explained that he attempted to discard it in anticipation of the search, resulting for the phone landing near my son's assigned area. Staff instructed my son to call the witnesses at the disciplinary hearing. On April 16, 2025, an investigation was conducted by CERT, Sergeant Moore Sr., CO Dakin, and CO Aries. During the inquiry, my son, another inmate, and ATL was escorted to investigations. Weeks later, CO Dakin told him investigations knew whose phone it was and that the phone data did not connect him to the device, and that the charge would be dismissed as disciplinary. At the time, the phone has discovered my son was in the yard, not inside the building. The inmate responsible submitted an emergency grievance and personally informed the staff that the phone was his. Supervisory staff assured my son the write-up would be dismissed. However, at the disciplinary hearing, the hearing officer refused to call witnesses, including correctional staff, stating their testimony would be redundant.
Wirecast.
Despite investigations, assurance, and evidence showing the phone was not my son's, he was found guilty of major violation. This resulted in the loss of statutory time and disqualification for a 180 program and the restitution center extending his incarceration. Multiple staff members later advised him to appeal, assuring dismissal, yet the grievance remains unsolved. I am elderly and in failing health, and an unjust decision has deeply affected our family.
This
I
is a
respectfully ask the Board of
demonstration
Review
of
Matters
Wirecast.
correct the disciplinary finding, restore the stat time, and reconsider my son's program eligibility. If I have any time left, I would just like to say this is my first time doing anything like this. My son made some errors. He didn't kill anybody, he didn't rob anybody, he didn't stab anybody, he didn't do anything, but he made major mistakes. And to this day, I'm 70 years old, I blame myself. I raised him. If more parents would take responsibility of their kids, my son's 42 years old, and I still own him, he's still mine, and I'm responsible for what he does.
This is a
That's the way I feel.
demonstration of
But listening to
Wirecast.
all this, my son got hurt in, when he worked for Silver State Industries, and he had knee surgery. Then he went on, and they transferred him to where he is now, Desert, there. He's had back surgery. The judge has said that the doctor botched the surgery. They took him for an epidural and put him in a car in 10 minutes and drove him an hour. We don't do that to women that have babies, let alone men that have back surgery and things. I'm just saying, I'm sorry. This is all,
demonstration of
I'm shaking because of my
Wirecast.
illness, not because I'm nervous, but I just found my niche. My son's going to be home. I know it with all of my being. I pray every day. I've lost my husband, my daughter, everything. They were sick for 4 years. He will be home, and those boys, wrong or right, people have to be respected. You treat people the way you want to be treated. So with that, I'll try to calm down next time, but I think you have a person that's going to help and get involved in this stuff. Thank you very much.
Thank you. Governor, we have one more.
Did I make a fool of myself?
Morning, sirs. My name is Larry Plumley. I was incarcerated for 34 years, and I would just like to make 2 points. Well, 3, actually. One, Director Zarenda, I think you're doing a great job moving forward with the department. I do have an issue with requiring mail to go through ViaPath, because for one letter to be sent, it costs 20 cents plus a $6.90 fee to ViaPath. And if that fee could be taken care of, then I don't see an issue, because I've been negatively impacted through the U.S. mail by all the spice these guys do in prison. It's crazy, and I understand the prison's position. But you should look at how much it's going to cost the family just to send one letter to the Department of Corrections before this AR is finalized. And the other thing is, like Ms. Jackson said, the grievance procedure.
This is a demonstration of
34
Wirecast.
years I've been in the department, 34 years, it's never been fixed. I understand you have frivolous grievances that clog up the system. You also have lazy workers that clog up the system. So grievances like Donald Jackson's or Megan Amir, who is at the women's facility, her grievance would have got her out of prison in January. I've looked at the case. It should have been resolved in January. Over a year later, it's sitting on the warden's desk. She expires April 9th. That's thousands of dollars the Department of Corrections could have saved by doing their job originally. So I just want to offer, if we could look at, and if you could look at, fixing the grievance procedure that's been broken. It's like dishes in a sink. You look at them and you're like, I'm not going to bother with that today. It's the same problem. Every issue that I hear at this table can be resolved at an informal level through the grievance procedure, because most of the time an inmate just wants to be heard. So a lot of those frivolous grievances
This is a
could be handled
demonstration of Wirecast.
there. But I don't know if it's a staff shortage, because you're always 25% vacancy in the department. So they use staff shortage to extend these grievances for years, and that's why you have so many lawsuits. So what I'm asking you, Mr. Zarenda, I know an ombudsman was supposed to be hired to fix the Department of Corrections grievance procedure. Can you take some action to fix resolutions like Ms. Jackson's, Megan Amir's, where these grievances that have merit should have been addressed during the time frame? If an inmate misses their grievance time frame, their grievance is dismissed, but the Department of Corrections can keep them going for years. I understand the problems with the grievances, and I'm just asking if you would look at that and look at ways to fix it. If you need somebody to type the data, listen, I got time. I don't mind. But whatever needs to be done, I would like for the department to look at fixing AR 740. Thank you so much.
Thank you. Is there anybody else for public comment?
This is
We
a
are done in Carson
demonstration
City.
of
Thank you.
Wirecast.
Right, we have public comment here in Las Vegas.
Good afternoon, members of the BOSPC. My name is Paul Lunkwitz, president of FOP Nevada CO Lodge 21. I come before you to present a solution to one of the most significant issues that faces our prison system today. Drugs and cell phones continue to be an insurmountable obstacle in the NDOC. Why is this such a difficult problem to solve? First answer is money. There's more money being used to introduce drugs to the prison system than the state is using to prevent or detect them. Resources are at a minimum for the NDOC, while profits for the inmates are at a maximum. The equalizer that has been proven to be effective at minimizing drug and contraband trafficking in prisons is K-9 units. Throughout the United States, K-9 units are utilized to perform all manner of functions within prison systems. Primarily, they are used in drug interdiction. What we know from experience is that every time one avenue for introducing contraband gets choked off, another is open. Michigan DOC put a hard brake on their inmate mail, which prevented physical mail with substances from being delivered to inmates. What happened? Legal mail quadrupled.
This
The
is a
NDOC changed
demonstration
to
of
clear containers for
Wirecast.
food, so people started putting contraband inside the food. In Ireland, they put a net over the prison so that drones couldn't drop contraband on the yard, so they dropped fireballs to burn holes in the net and then dropped the contraband through the holes. There will always be a need to search for contraband inside prisons. K-9s can effectively and efficiently detect narcotics and cell phones. This minimizes the need for massive officer search teams, exorbitant overtime, and operational shutdowns. When mass searches occur, the yards are shut down. Imagine having 5 K-9 units
This
able to
is a
search multiple
demonstration
units
of
for
Wirecast.
narcotics and cell phones in a matter of minutes. Instead of an entire shift of searching a unit, we would see a couple hours of downtime, then you're back to normal operations. This helps prevent escalating tension from indefinite lockdowns while removing these substances that cause greater violence and overdoses. What is the savings for the state? When drug violence and overdoses are reduced, the state saves money on medical costs for treatment at local hospitals. When these incidents result in inmates at the hospital, you have your primary driver of overtime within the prison system, hospital duty.
This is a
Hospital positions are
demonstration
almost
of
completely
Wirecast.
unfunded, which creates a sinkhole of overtime. Ask Director Zarenda, and he will tell you, as he stated earlier, this constant vacuum of overtime is not avoidable. So what causes the hospital stays? Overdoses, drug violence, and a lack of medical resources to treat inmates at the prisons. How can we provide this resource together? FOP has already solicited volunteers to run a nonprofit that will be independent of the union and the NDOC. Through the generous donations of casino and business owners, the foundation will be capable of funding the amounts needed to
This is a
create and sustain
demonstration of
the K-9
Wirecast.
program. We have discussed the training with Arizona DOC, who has offered to train our K-9s and handlers for free. The state merely needs to reallocate 5 of the unfilled positions, either in the south or at rural areas, to the director's budget in order to form the initial team of 5 handlers. I've outlined this process in greater detail in the proposal that I provided for the governor and the BOPC today. This will not take a tremendous amount of time to get established. All we need at this point is to get your approval to move forward toward
This
making
is a
our prisons safer,
demonstration of
while at the same time
Wirecast.
reducing costs associated with the drug and cell phone problem in the NDOC. FOP hopes to work with the state in launching this program to provide safer prisons for officers, supervisors, and ultimately the inmates we are responsible for. Thank you for your consideration.
Paul, you
Yes, sir.
mentioned drugs and cell phones, but you didn't talk about, so the dogs are able to detect cell phones?
Multiple substances, including cell phones, yes. And all that
This
training
is
is
a
done in Arizona, the
demonstration
same
of
training
Wirecast.
facility. They train for, once they get trained for scent detection and the cell phone detection, they have 2 separate training protocols for both of those things. And then the scent detection can be used for multiple scents. Larry Nava, who's extremely experienced, can speak more to that if you. Thank you.
Secretary Aguilar, does he have a copy of this proposal?
He does not, but I'm happy to email it to whoever.
Cisco, did you hear that?
This
I did.
is a
Thank you.
demonstration of Wirecast.
Any questions?
No questions.
Thank you.
Thank you.
Good afternoon. My name is Waylon Brown, W-A-Y-L-O-N. Brown is in color. I'm a correctional officer for the state of Nevada. I want to briefly talk about something directly impacts the safety of our officers, contraband inside of our facilities. Drugs and illegal cell phones are 2 of the biggest drivers of violence
This is
inside
a
of our prisons.
demonstration of
Drugs create debt,
Wirecast.
intimidation, overdose, assaults, and even homicides. Cell phones allow inmates to continue criminal activity from inside prison walls, coordinating drug trafficking, fraud, and gang operations. In Nevada, suspected overdose inside prisons have more than doubled in a single year. With over 100 inmates hospitalized, that's not just a statistic, it reflects the risks every officer faces daily. Across the country, more than 80% of Department of Corrections
This is
use
a
canines
demonstration of
for narcotic
Wirecast.
and cell phone detection because they work. A strong example is the Arizona Department of Corrections, which operates over 50 dogs that search housing units, mailrooms, visiting areas, and vehicles, finding contraband quickly and effectively. Just as important, canines create a deterrence. When inmates know searches are conducted by dogs, they're less likely to be drugs in, or they dispose of them to avoid detection. Either way, those drugs are removed
This
from
is a
circulation.
demonstration of Wirecast.
Canine teams can search faster than an officer alone, what takes an officer hours to search. A trained canine can pinpoint the exact area in minutes and take us straight to the contraband. While most correctional systems in the country have adopted canine programs, Nevada is one of the few states that have not. But we have an opportunity to change that. The only thing needed from the state is the reassignment of current underfilled and already funded
This is a
PCNs
demonstration
to
of
create a canine
Wirecast.
handler position. No new positions to be created. Once PCNs are assigned and approved, we'll be able to start the work in getting this program up and running and begin achieving results. Support is already in place. Arizona Department of Corrections has offered free training, including room and board for handlers and dogs in both narcotics and cell phone detection training. Every officer deserves to go home safely at the end of their shift. This
is a
isn't just about
demonstration
a
of
program.
Wirecast.
It's about making sure Nevada is not one of the last states without a proven tool to protect its officers. If more than 80% of correctional departments already are using canine detection teams, the question isn't why Nevada should start. It's why we are one of the few that hasn't. Thank you.
Good afternoon. My name is Larry Nava, an AVA. I'm a correctional officer with Nevada
This
Department
is
of
a
Corrections.
demonstration of Wirecast.
Repeat what Director Zarenda said earlier. Our department is one of the few law enforcement agencies in the nation that does not have a canine division. Nevada Department of Corrections had 76 offender in custody deaths in 2025 and 19 so far in 2026. Violence is the biggest issue in correctional facilities, and drugs are the key factor. From inmates being under the influence to the collection of drug debt, these issues are what spike that. Cell phones are used to
This is a
conduct drug business,
demonstration of
coordinate gang
Wirecast.
activities, and threaten victims and their families. The use of the use of dogs in the prison system has been overwhelmingly successful in the detection of drugs and cell phones. My experience goes back several decades as a canine handler and police service dog trainer, both nationally and internationally. Prior to NDOC, I was with the Arizona Department of Corrections. I contacted Steve Lowe with Department of Corrections in Arizona and have arranged for our dogs to be trained at the Correctional Officer Training Academy in Tucson.
This is a
Our canine teams
demonstration
will be
of
certified in
Wirecast.
drug detection, which includes K2 and SPICE, contraband, and cell phone detection, and our teams house at the training facility at no cost. I joined the department more than 6 years ago and have been trying to implement a canine program with no success. The proposed program will be entirely funded by generous donations from local casinos and businesses that I have contacted, and they are more than willing to contribute, with some asking for no recognition. The 501c3, having a board of local business owners, would oversee the expenditures of all funds, very similar, actually the same way that Las Vegas Metropolitan Police Department has theirs overseen. This program would cost taxpayers nothing. The only thing that we're asking is reassignment of PCN positions to High Desert State Prison and the use of the already existing kennels that are there. Thank you for your time, and I welcome the opportunity to discuss this proposal further.
I'm Officer Jason Steinhauer,
This is a demonstration of
JASONSTINEHOUR. I'm a correctional officer at I Desert State Prison and Sergeant at Arms for FOP Nevada CO Lodge 21. We need this program. I work in the infirmary. I worked there last year and I worked there this year. Right now, we do have an inmate up there that I know that has came in for medical appointments, just general checkups, and he was fine, laughing, joking. Now he's in there housed, being under mental health watch.
This is a demonstration
He got
of
hold of bad
Wirecast.
spice. He doesn't even know where he's at. If we could have detected that, he probably be functioning now. It's like he's in another world. And I've been hearing also by other inmates that when they get a hold of bad spice, it's not just fentanyl. They spray it with Raid, bug killer. That can be detected by dogs. We can't detect it because once it dries, you can't smell it, but the dogs can. So this is a program that we really, truly need. It doesn't cost anybody any money.
This is a
And
demonstration
it is
of
very
Wirecast.
sad, even though I'm an officer, it is very sad to see somebody that can function normally come into the infirmary under mental health watch and don't even know where they're at. It's like they're in another world. It's sad to see. We need to do something. And this is one step closer to doing something. We do have other ideas, but it would take a meeting with you, Governor, Director, and the other board of prisons with FOP
This
to sit
is a
down and
demonstration
have a
of
meeting to
Wirecast.
discuss other ways to help keep everybody safe with little to no cost to the state. Thank you.
Thank you. Anybody else? Thank you for your time. All right, I'll make a motion for adjournment. All in favor, signify by saying
Aye.
all right. Thank you.
This is a
Thank you all. Have a good day.
demonstration of Wirecast.